Welcome to Patient Tracker. This is a remote patient monitoring application that can be accessed via the internet through a web browser or a mobile device such as an iPad, a tablet, or your mobile phone. So to get started, we are going to start with the patient care plan. So to add a patient care plan into the application, you just simply navigate to the top, pick care plan, and add a new care plan. In this particular case, we're going to do an acute care plan, and this will be for simple wound care, we'll say. And now with simple wound care, we go in and we put in the care plan summary. So this is a summary of what the care plan is all about. And then the action plan for vitals in terms of what we want them to monitor or maintain when it comes to vital information. And then any symptoms that we want them to be cautious of. And then anything that we want to communicate to the patients regarding appointments. And then the lifestyle that we would like them to maintain when it comes to managing this simple care. You can have as many care plans as you want. And you can have any layout that you want. This is a simple layout that we put in there for the action plan vitals, action plan symptoms, and appointments. You can add as many one of them or use any type of nomenclature that you choose. But once you have that into the system and you have it filled out the way you like it, you just simply hit save, and now you have that action care plan in there. So now that we have that, we're going to assign that to a particular patient. So we go back here to the main page and we locate a patient, and we're going to take this patient right here. So we look at this patient record. This is a newly patient enlisted into the system or into the program. So now what we're going to do is we're going to want to monitor this particular patient. So through their mobile app, they're going to get alerts and notifications when it comes time for them to record certain pieces of vital information that we're going to be looking from them. And we can choose which information we want to monitor. So to do that, we're going to go to this section here where it says Add Vitals, and we're going to say for this particular patient, we want to monitor, we'll say their heart rate. We want to monitor them for infection, so we're going to say we're going to want that to start today. And we're going to send them an alert every morning, we'll say at 9 o'clock, and that will end by default in 90 days. And we can shorten that or we can lengthen that just by changing the date here. So now we've got the heart rate is what we want to monitor for that patient. We can go back. So there we have it here. We're going to be monitoring the heart rate. We want to add another one in there. Let's monitor the patient's blood pressure. And we'll start that today as well. And we'll say 10:30, we'll send them a message to let them know that it's time for them to record the blood pressure for us. We'll save back on that, and now we'll say that this patient is monitoring for pain management as well. So we'll go in and we'll say we want them to do a pain scale. We're going to start that as well. We'd like that around noon, see how they're managing it throughout the day in terms of their medication. And again, we'll monitor that for 90 days. So we're going to save and back on that. So now we have these vitals so that when they log in, they'll be requested to supply this information to us. In addition to that, we're now go in and we're going to track some medication. So obviously, or ideally, if we have a medication list for the first reconciliation, we can do that ourselves. So the first thing we want to know is for this particular patient, what medication are they on? Now we know we'll say that this patient takes Coversil. So we'll put them on Coversil, and we're going to put them on, we'll say 2.5 milligrams. And they're already on that, so they say they started that back in January. And we'll leave the last reconciliation out just for demonstration purposes, but you would click this circle here to indicate that that was reconciled today. And the discontinued is when they come off that medication. So we're going to have them on Coversil, and for this particular patient as well, we're going to put them on some pain management. So let's give them some, let's pick Dilaudid. So let's give them Dilaudid, and let's give them 2 to 4 milligrams as needed. So we can do 2 to 4 milligrams, or we can just type in just the 2 milligrams or 4 milligrams, but for demonstration purposes. We'll stay with that. And then we're going to put them on that as of today. And then we can reconcile that as of today. We just started them on that medication. So we're good with that. So now we come back, we can refresh that page, that will reload, and that should give us the pain management and the medication that this particular patient is on. So we have the CoverSil, we have the Dilaudid. Now we need to put them into a care plan to manage whatever it is that we're managing for this particular patient. So here's the patient. The target date for this one, this is going to be, we'll say, a 30-day care plan. So we'll take this, this is the 1st of July, we'll take you to the end of July. So you got 32 days on this, and we want to give you the simple care wound. So you can see now that that went in and it pulled out all of the detailed information with regards to what we set up as the default information when it comes to simple care wound. We can add any additional information that we want in this. We can personalize it to reference something specific about this particular patient, but you can do whatever you want in this patient care plan to modify it, update it, or whatever else have you. Here's your target date. In this particular one, it's a 60-day target. So we're going to save this plan here. And now we have, again, another refresh here just to pull that data in. We have their care plan. When I hit their care plan, I should have hit save there. So when I save that care plan, now I have their care plan here. The target on this care plan is a 60-day target plan. And now we're going to add some team members to this patient. So these are the internal care team members. So we're going to put Dr. Raven on this, and here's a bit of a biography on Dr. Raven that you can choose to fill out and then have that information available to the patient. So we're going to save that information. So now we know who is this patient's part of their team, and we can add as many team members to this patient as we so desire. So we go back to the main page. And we're all set. We have the information in. We have the care plan instituted. We have the medication there. And now what we're left with is the patient interaction. So what that looks like would be, this would be the mobile app. They would download it from the Play Store, and they would be given a username and password. And we'll just log them in quickly. And this is what they would see, the patient would see when they first log in. So the name of the clinic would be up here. They log in, and now they can go through the mobile app. I can see my care team. There's Dr. Raven. Here's a little bit of a biography on him. I can choose to send him a message by clicking on that tab. I can go down into my care plan, and I can see here's my simple wound care plan, and I can go through that information. Again, I can send information if I have any questions regarding this wound care plan. I can add those notes in here and then send that information back to my primary care providers. I can go into now the vital information. So again, here's the vital information. I set the alerts so that the alerts will fire off messages, and this app will play a sound letting them know that it's time for them to record the information. So the information we're going to record here again is the heart rate. Starts off the very first one. We'll give them a heart rate of 65, and just to give you an idea, that's recording it here. But as that goes on and builds up, we're going to rate that. We'll give you a heart rate of 88. And you'll see now that that's going to start graphing that information. So your first reading was June 29th. The second reading was June 29th. So as you add additional readings to this, those rates will come down. So if we did a 120 heart rate, for whatever reason, we can see that the heart rate's starting to climb. So we do that, it changes to from orange to blue, indicating that that's been recorded for the day. We got a blood pressure here. We're going to say we'll do a nice blood pressure here of 110/70. So now we have that blood pressure recorded. There's the first reading, the 110, the 70. We'll do another blood pressure here. We'll put them a little, we'll go 80/50. And that will show a blood pressure drop for this particular patient. That will continue to record that information. And then we can obviously do the pain scale here the same way. We've got a pain is 5 at the time of day that we're recording it, and it will tell us what that information is. So we add that information, and now we're going to go a pain scale of 2. You can see that patient's clearly getting better when it comes to that information. And all this information is available to you as the clinician, and you'll be able to see this information that it's coming into you, and you'll be able to act and react on it. You'll be able to send out messages, text messages. You'll be able to send out phone calls. You'll be able to alert individuals. So if a patient does have a sudden drop in blood pressure, or blood pressure that you feel is out of what is expected for the medication, then it will send out immediate notifications and messages to any particular group of individuals, or an individual. Could be a family member, could be the primary care provider. So we have that scale information, and then you have the messages. And then the messages would give you the ability that you can text directly back and forth with your care provider. So if there was a particular, say for wound care, that you were communicating with your primary care provider, you would be able to go into the messages there, and you would click click your provider, and here you'd be able to send the message, and then that information gets sent back and forth. And in addition to that information, you can also take a picture. So if this is wound care and there's a problem or an issue with the wound, they'd be able to snap a picture of that wound and send that information back and forth, and you'd be able to monitor that as well. The other one I missed here is the medication reconciliation. So you come in here, you see the patient here, it shows the last time the medication's been reconciled. You see the cover still hasn't been. And again, for the patient to do that, it's reconcile. Are you still on the cover still? Yes, I am. That's the dosage that I'm hitting save, and then that puts in the reconciliation date. The patient can reconcile these themselves. So if the patient's on 2 to 4 milligrams, are you still on it? Yes, they can go in here and they can update this information, say that right now I'm now on 4 milligrams. So that will update that information. They're taking the 4 milligrams, and that will reflect that change in their record. They can start new medications. So let's say their family physician, or they've just decided on themselves that they're going to start taking, say, a daily dose of ASA. So that's going to be starting today. And now any notes that they want to put in there, they can, or they can add that information in, and now it shows that they're starting the daily ASA regimen. So that would be the experience of the patient in compared to what the provider of the healthcare provider would experience. And then all that information gets tracked here. So now we can see the information here, the times, and then we get to see the pain management. The current pain scale was a 2, their highest was a 5, the lowest was a 2, and we've got 2 readings so far, and the current pain is at a 2. Same with the blood pressure. Right now we're monitoring the systolic blood pressure here. We have a systolic blood pressure of 80. The highest ever was a 110. Its lowest right now ever is an 80. And then the same with the heart rate, where we're monitoring the heart rate. Medication here, again, the Dilaudid. We started the Dilaudid. I didn't refresh this to reflect the ASA. So we'll quickly refresh that, and you'll see that the ASA was started on the 29th, and the Dilaudid was reconciled as well as the cover, so it was reconciled. And then the wound care management, again, is down in the bottom. And that is a basic overview of PT Tracker.